I reckon you've just hit the nail on the head. So I've been getting lots of calls from my ex-colleagues in health asking me what it's like to be out of health. You know, it's a pretty tough gig at the moment. And my question back to them is, why do you think I've stepped out of health? Exercise is the most natural way of actually, making yourself feel better and actually preventing yourself from being unhealthy later on. And when you think about it, the health minister has traditionally also been the sports minister. So if you want to think about sports as your proxy for exercise and activity as we think it should be, for some reason the health minister, despite wearing the same hat as the health minister, being the same person, those two things have never come together in the consciousness of the person who's going to be making decisions about how many hospitals they have to fund and how many GPs they have to pay and how many healthcare professionals they have to educate. And really what I'd like to see happen is, in that idea of true prevention, where someone doesn't have to be damaged before they're diagnosed and then gets help from the health system, I'd really like to see them actually be chasing upriver to actually getting people moving. We've got 47% of the country have one or more chronic diseases. When we think chronic diseases, we're thinking type 2 diabetes, completely reversible; heart disease, completely avoidable, often reversible; cholesterol, completely reversible, often avoidable.